Eyelid twitching, or myokymia, is something many people experience but rarely understand. You wouldn't believe it, but even as an eye doctor, I experience it too, and for me, it was often come and go. Do you ever notice that it's mostly the lower lid? Why do our eyelids twitch or flutter anyway? Is it a sign of something dangerous going on inside our eyes, or even our brains? Here's 10 fun facts about these eyelid twitch moments. Be sure to stay for facts number 4 and 7. It would blow your mind. Fact number 1. Myokymia is usually harmless. Eyelid twitching is almost always benign and self-limiting. That means it usually goes away on its own, even without you doing anything. So, you can basically peace out right now if you want to, because that's all you'll really need to know, right? But no, I hope you stay. It does go back over and over if you don't avoid what's triggering it. So please stay to listen to fun fact number 2. Fact number 2. Stress, caffeine, and fatigue are the top triggers. These 3 are the most common culprits. Even eye strain from too much screen time can contribute. So which type of job do you think would land you with the highest incidence rates of myokymia? Fact number 3 answers that question. Okay, think about it. Which job has all 4 in abundance? Tons of stress and fatigue, barrels of caffeine, and loads of screen time? Yeppers, you got it right! It's medical students, and that's why myokymia is also coined as medical students' disease, because of their high levels of stress. I think you know who are close second. Yes, BPO or call center agents have toxic work schedules and work environment with loads of coffee. Fact number 4. It can last a few seconds, to as long as weeks. While most twitches are brief, some people experience recurrent episodes for days or even weeks. This one really surprised the heck out of many. I mean, who wouldn't be? I just told you it would go away, even without treatment, right? But for some, the fluttering lasts days and can be bothersome. So stick around for free doctor tips in the end. Fact number 5. It affects the lower lid more often. People typically report twitching in the lower eyelid rather than the upper. Well, this could likely be due to the lower eyelid's thinner muscle and the fact that this muscle is nearer the facial nerve which innervates these muscles. Fact number 6, not actually the whole eyeball. It might feel like your whole eye is twitching, but it's actually the tiny muscles around your eyelid. Look at the medical name, myokymia. Myo is Greek term for muscles, and kymia means small waves, or undulations. So by its name, it's just the tiny muscles that are jerking, not the whole eye. Fact number 7, superstitions exist around it. In some cultures, eyelid twitching is believed to predict good or bad luck, depending on which eye twitches and whether you're male or female. Here are some interesting examples. In China and India, right eye twitching means good luck, especially for men. Left eye twitching means bad luck. But for women, it's often reversed. In Africa, especially Nigeria and Ghana, eyelid twitching may mean someone is talking about you, good or bad depending on the eye. In the Caribbean and Latin America, a twitching eye might mean you'll soon see someone you haven't seen in a long time, or you'll receive unexpected news. In the Philippines, many Filipinos also believe that eye twitching is a sign of upcoming events, good or bad depending on the eye. Kumikislat ang mata, you may have visitor or news coming. But medically speaking, it's usually just fatigue or caffeine, no fortune-telling involved. Fact number 8. It can be a sign to slow down. If you stay around until fact 10, I'll give you doctor tips on how to avoid twitching recurrences. So thank you if you do. Persistent twitching may be your body's way of asking for rest or a digital break. It may be your body's way of saying, "Hey bruh, get enough sleep. Can we, for once, aim for 7 to 8 hours? We need a reboot of the system, man. The circuit's going crazy, hyper-twitchy, and glitchy. Look at 'em eyelids. It's a freako sign, slow down, bruh." Fact number 9. Rarely, it could be a sign of something more serious. But relax, this is very uncommon. Chronic twitching can be linked to conditions like Bell's palsy, or yes, it can be linked to seizures, specifically in conditions like epilepsy or fancy Jeevan syndrome. This syndrome is eyelid twitch, with eyes rolling upwards, and with brief mental disengagement during the episode. So you see, it's not an isolated case of eye twitching, but a group of signs and symptoms that happen together or in sequence. But I reassure you, these cases are far few in between. Fact number 10, there's no cure, just good habits. As promised, here are 10 quick, simple, effective treatments and remedies. I promise these are really quick. 1. Get enough rest. Fatigue is a major trigger. Take breaks, time-offs, and day-offs. 2. Cut back on caffeine. Coffee, energy drinks, sodas, and even chocolate can overstimulate or tickle the nerves. Try limiting your intake to see improvement. 3. Manage stress. Use relaxation techniques like deep breathing, meditation, and prayer, or short breaks from screens and work. 4. Apply a warm compress. A clean, warm towel over the eyes for 5 to 10 minutes can help relax the twitching muscles. 5. Stay hydrated. Dehydration can cause muscle spasms. Drink plenty of water throughout the day. 6. Use eye lubricants or artificial tears. Dry eyes can irritate the muscles. Use preservative-free artificial tears to soothe and moisturize the eyes. 7. Limit screen time. Take breaks using the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. 8. Eat magnesium-rich foods. Try bananas, almonds, avocados, leafy greens, or even magnesium supplements. Ask a doctor first. Lack of magnesium may make the eye twitchy. 9. Do a gentle eye massage. With clean hands, gently massage around the eyelid in circular motions. This increases blood flow and helps the muscle relax. 10. Track your triggers. Keep a diary of when it happens. This helps identify if it's due to stress, a new medication, or too much caffeine. Thank you so much for having stuck around this long if you did. Your likes and comments encourage me to make more helpful content. I'll see you around in my future videos. Take care.